Breast cancer this October, and there's a lot we do know, like the connection between family history and developing cancer.
But not every woman who gets breast cancer has that family link. There's an easy test that can determine risk for us. Check this out.
1 of every 8 women in this country will develop breast cancer, but only 10 to 15% of those cases will involve a family history of the disease. Now there's a new and affordable test for the 85% with no family history. It's called BREVAGenplus. Using cells from a simple cheek swab, BREVAGenplus looks for patterns in a woman's genetic code. These so-called SNPs are associated with a risk of sporadic breast cancer, the most common kind.
Offering a test like BREVAGenplus is one of the most wonderful things that we have going for us right now, because it allows us to identify a whole group of women that we didn't know had risk factors before. We can help to prevent more than 50% of those cancers by giving medications, which are commonly available and very easily taken. We can talk about lifestyle adjustment and certain factors that a patient has control over in her life, such as her diet and her exercise. And we can also use different types of imaging and more frequent examinations.
BREVAGenplus also considers clinical risk based on the patient's age, when she got her first period, when she had her first child, whether she's had breast biopsies or a family incidence of breast cancer.
BREVAGenplus is a very affordable test for most women. Most insurance carriers will cover this. For those who don't, the most it costs a patient is a few $100s. The test is appropriate for most women over the age of 35, and that would apply to Caucasian women, African American, and Hispanic women, women who have some degree of risk factor, or maybe even none.
With information provided by BREVAGenplus, women can work with their doctors to better manage their risk of developing sporadic breast cancer through a personalized breast cancer risk reduction and screening plan. For more information, visit BREVAGenplus.com.